Imagine waking up after surgery and feeling a bit hazy, perhaps a little confused about where you are or what day it is. This temporary state can feel unsettling, and it is a common experience many people face during their recovery journey. After surgery, signs of disorientation can include memory problems like forgetting recent conversations or struggling to recall where certain items are. You might also experience significant difficulty concentrating on even simple tasks and feel generally confused about the time or place. Other indicators are changes in your usual thought patterns, trouble following multi-step instructions, or even subtle personality shifts, such as becoming more agitated, restless, or unusually quiet and withdrawn. This temporary mental fogginess often stems from several intertwined factors affecting your brain's normal function. General anesthesia, for instance, temporarily alters brain chemistry, and its lingering effects can cause a period of mental cloudiness as your body works to eliminate the medications. Strong pain medications, particularly opioid analgesics, significantly contribute to this by slowing down cognitive processes and causing drowsiness, which impairs clarity of thought. The immense physical and emotional stress surrounding surgery, coupled with disrupted sleep patterns in an unfamiliar hospital environment, also plays a profound role in cognitive challenges. Furthermore, physiological changes like dehydration, imbalances in electrolytes such as sodium or potassium, or even a low-grade post-surgical infection, can profoundly impact brain clarity and lead to confusion. Essentially, your brain is under increased demand to process recovery, manage pain, and adjust to new surroundings, which can temporarily overwhelm its usual sharp functioning. If you or a loved one begins to notice these signs of disorientation, the first crucial step is to gently observe and communicate openly. For the person experiencing confusion, simple reorientation techniques can be very helpful. Calmly reminded them of the current date, the time of day, and where they are. Ensure they are receiving adequate rest, prioritizing undisturbed sleep whenever possible. Crucially, emphasize staying well hydrated by encouraging sips of water or clear fluids throughout the day, unless medically advised otherwise. Always alert the healthcare team or a designated caregiver promptly about any changes in mental status. They can then conduct a thorough assessment, checking for underlying causes like adverse medication side effects, electrolyte imbalances, or the onset of an infection, and adjust the care plan as needed. Creating a calm, familiar, and well-lit environment, free from excessive noise, can also provide significant comfort and aid in mental recovery. This post-surgical confusion is often clinically referred to as postoperative cognitive dysfunction, or POCD, or sometimes as delirium. It is really important to understand that while encountering these symptoms can be quite unsettling for both the patient and their family, it is typically a temporary condition. The vast majority of individuals experience a complete recovery, regaining their normal mental sharpness and cognitive abilities within a span of weeks or a few months after surgery. Early recognition of these signs and proactively addressing any contributing factors are fundamental to minimizing its duration and mitigating its impact on overall recovery. Therefore, recognizing these specific signs of disorientation should not be a cause for alarm or panic, but rather a clear cue to respond with gentle vigilance and proactive, open communication with your medical team. By understanding the common underlying reasons behind this temporary mental fogginess and promptly involving your healthcare providers, you can actively support a much smoother, quicker return to your clear thinking self. This informed approach leads to a more comfortable and reassuring overall recovery experience for everyone involved. Patience, understanding, and consistent support truly make a world of difference during this sensitive time.